name's Charlotte Fleming and I'm the Assistant Trial Manager in the WOMAN-2 trial. As you know, we've been doing a lot of on-site and remote monitoring over the past couple of months. During this monitoring, we've noticed some common issues that people are having with using the HemoCue analyzer. So the purpose of today's video is to do a refresher training on how to take a blood sample and use the analyzer. So before you take a sample, you want to make sure that you have all of the materials that you need ready and organised. So you'll need your HemoCue analyzer. This can be powered by batteries or the adapter which comes with the device. Your microcuvettes, the lancet, alcohol wipes to clean the patient's finger, lint-free wipes or gauze to dry the finger and remove the first couple of blood drops, gloves, and a means of disposing of the microcuvettes. Before you begin taking a sample, you need to check that the microcuvettes are in date. So check the expiry date and also check the date of opening. If it's been 90 days since the microcuvettes were open, these are no longer able to be used, so you should use another tub. Next, you want to prepare the lancet. Ensure that the lancet is on the highest setting. This is so that you get a good enough prick to get a very good blood drop. And then set the lancet by pulling the white bit at the back. To release, you press the orange button. When taking a blood sample, it's very important to wipe away the first 2 to 3 blood drops. A common issue we found during monitoring was that the alcohol wipe is being used to wipe away the first 2 to 3 drops. This contaminates and dilutes the blood drop. See how the diluted blood drop spreads across the finger. Do not use the alcohol wipe to wipe away the blood drops. Instead, use dry gauze or a dry lint-free wipe. Another common issue we found was the blood drop is often too small to fill the microcuvette properly. This risks a false low reading. If you cannot fill the cuvette in one continuous process, the blood drop is too small. You should never repeatedly dip the tip of the cuvette into the blood drop. I will now show you the correct technique for how to take a blood sample and use the HemoCue analyzer. It's important once you've taken a microcuvette out of this that you put the lid, you shut the lid properly because that preserves the shelf life of the microcuvettes. So now that that's set, we can prepare the finger. To do that, take one of your alcohol swabs and then select a finger from your participant. So you want to use a finger without any rings on it and not the thumb. So the forefinger is fine. So we'll just clean the forefinger using your alcohol swab. And just dry the finger. Okay. And then you want to make sure that there's enough blood in the finger. So stimulate the blood flow by just pushing up towards the tip of the finger. Okay. Take the lancet and puncture the side of the finger, not the middle, so just on the side. Like that. And then continue to squeeze. And then you want to wipe the first 2 to 3 blood drops away. Continue to put pressure on the finger to make sure that the blood drop is really large. It's really important to have a large blood drop, otherwise the microcuvette won't fill properly.
Oh, that looks
and it will give
good.
you a false reading. Then take the tip of the microcuvette and just hold it in the center of the blood drop for approximately 2 seconds until it fills completely. Carefully, without taking any of the blood out of the microcuvette, just wipe the outside if there's any excess blood. Check the microcuvette to make sure that there are no air bubbles. And then put it in the cuvette holder. Thank you for watching. If you have any questions, please email the WOMAN-2 team or WhatsApp us.